Right, Kunal, thank you for that. Okay, I'm going to bring on board Dr. Hemant Thacker now. I've also interacted with him personally on different forums. He's a complete expert when it comes to understanding how the virus patterns are moving. Dr. Thacker, good morning. Thank you for joining us. Based on your understanding of the virus spread, do you think a lockdown in a state like Maharashtra is necessary? Because you've been making a case that in order to fight this war, we need a good doctor, we need a good prescription, and we need adherence.
I agree with you. All these three factors are right. We've woken up to a bright, sunny morning. But despite the sunny morning, we are very much still in the woods, because there is still time to trudge before we get out of it. Since yesterday and day before, we've been seeing new cases sprouting in the community. These do not have a travel history. These do not have a significant contact. So it seems that if we are already in stage 3, then we need to put our heads down, work perseveringly. And we don't know this enemy. You know, you can't see it, you can't smell it, you can't touch it, you can't feel it. So you got to hide from it. So the lockdown has done well. I'm not taking away or detracting from the benefits of the lockdown. But I think we may need to extend it a little more. More so because there has been a slip up in the adherence or the compliance factor. And we've had people not adhering to it and seeding it in the community. So to flatten the curve, and the word flatten the curve, if I may explain, is to allow the disease to progress in a slow fashion. Now, why slow fashion? It's not as if you can snuff the disease out. You have to stay with the disease. But if you allow it to progress in a slow fashion, two things happen. The virulence of the virus then gets tempered down. And the second thing is that the healthcare services, from doctors, ambulances, hospitals to police, drugs, everything, then is not overwhelmed by the numbers and is able to deal with this. As a result of this, overall, the community gets herd immunity. So we are then able to temper it. The world over, we've seen 3 weeks is not enough. If we do another 5, 7, 10 days, depending on what the health ministry and the health authorities feel, we probably will reap the fruits of this extended lockdown. If we, however, prematurely stop it, only to reintroduce it later, it would be leaking out the water from the dam and then trying to fill the dam again. So I think we are still not out of the woods. We are still very much in the woods. To get out of the shade and into the lovely unpolluted sunlight as we look up in the skies from our balconies, we'll need to be a little more careful, a little more sacrificing, because this will help us in the long run.
Would you advocate the theory of partial lockdown, sir? When I say partial lockdown, open states where the virus has not spread, but keep states and cities and districts where the spread has already happened, places like Mumbai, Delhi, Kerala, Tamil Nadu?
I agree with you. There has to be a focus more on the hotspots. It's like a terrorist attack. The places where the terrorists are holed up, you cordon off, you curfew, but you don't let the other places suffer. So definitely whenever the lockdown is removed, it will and it should be in a staggered fashion. Now, what your question was, whether certain places where the virus is not so much spread, whether you can immediately lock them out and undo the lockdown and allow them to come out while keeping the hotbeds locked down, the answer would be 3 weeks is the bare minimum. If you want to do the bare minimum and then push it out slowly, I think that would be it. To err here is better to err on the side of caution, on the side of more than on the side of less. And if you did that, you have to cordon off the borders of that city or the state. Otherwise, those people could come into the hotbeds and the transmission would be very quick, because the COVID-19 is an extremely infective virus. And only time will step down the virulence of this virus. So we need time. I mean, Europe or America or even Japan, today is the first day that Wuhan has been officially lifted. So countries, if we have to take a lesson from, or a leaf out of their page, then we have to see that their lockdowns did go on for a month or even more. So let's be a little prudent. I know we are all rearing to go. We are really locked up. The honest ones amongst us are really all pent up. But a little bit of a sacrifice, is like an investment. This is an ET Now channel, and you teach us to save our pennies only to make them grow into pounds. So I think if we did that for a few days more or a week or two more, we could probably garnish and reap the fruits of our health harvest.
I'm glad you're endorsing the belief of ET Now, and let me endorse your view, which is survival first and revival later. So one follow-up question, sir, since we have a very strong urban audience, Delhi, Mumbai, what is your understanding of what is going on in hospitals in Mumbai and Delhi? Because unfortunately the news flow about how some of the hospital staff, nurses, doctors are getting affected is quite alarming.
So now let me paint the silver lining to the, so as to say, grey clouds. Our mortality is very low. We may be getting positive cases, but we are not getting deaths like Spain, Italy, or even New York. The question of infection of nurses and doctors. How does spread occur? Spread occurs through contact. If I am in more than 20-minute contact in more than one occasion times, obviously the likelihood of me picking up the virus from the opposite person whom I'm in contact with is more. So who is in contact with these people? The white warriors, the nurses, the ward boys, they are treating and looking after the patient the whole day long. So they are going to get infected. How many nurses for mundane duties are going to keep wearing PPE the whole day long? It's a catch-22 situation. When in intensive care, the doctors, the nurses definitely wear a full PPE. But we don't know when the virus stops shedding. You move a patient out of ICU after 14 days and he's about to go home. And if he still sheds a dose of the virus, and if the nurse picks it up, so obviously they are likely to pick it up more. I mean, a bus conductor is going to pick up the virus from his passengers and not the driver, because the bus conductor is in contact with them. Similarly, the nurses and the doctors are more in contact with them than those who are at the admission counter. So the situation is not alarming. The situation is new. So there is a lot of curiosity, apprehension, and anxiety and worry. But let's not make the disease more than the precautions more than the disease. After all, what we need to do is take care. And we are doing everything for our nurses. I hope we have enough PPIs to last us. The government has promised us, and I trust the government. So I think if the urban viewers and some of the rural viewers can hold their horses for a little more time, not fall prey to the rumor mongering and the WhatsApping, then I can tell you the silver lining is not so many deaths at all, not so much virulence. We have still spare ventilators. My patients have not had it to make a scramble for the ventilators. So we are coasting. We are coasting. We are Indians. We have a different genetic makeup. We have BCG, we have malaria, we have everything. We withstood the H1N1 and we are going to withstand this now. So let's hold our breaths and wait.
On that note, Dr. Thacker, thanks so much for joining us, and it's always good to hear something reassuring like that first thing in the morning. Take the precaution, but don't worry out of turn either. Thanks so much for that.